tonight.
For about 2 years, it was just so much pain. I would lift my arm to shoot, it just would send a lightning bolt through my shoulder. I was taking 2 different pain medicines just to get myself through the day.
An ABC 27 special presentation.
She jumped off the balance beam, kind of fell forward, stood up and said, "I broke my arm." Just unbelievable seeing that, your little daughter with her elbow going the wrong way.
Penn State Hershey Bone and Joint Institute presents Break the Pain. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes, and thanks for joining us. Bone and joint pain affects the young and the old and includes a wide variety of medical problems, from fractures to osteoporosis. 1 in 2 women 50 years of age or older are likely to have some type of fracture that's more common than heart disease or cancer. Spine fractures are the most common types of osteoporosis fractures in postmenopausal women. However, many go undiagnosed because they're never brought to medical attention. Many of us learn to live with our aches and pains and avoid going to the doctor for care, but severe shoulder pain, well, that debilitated a Lebanon County woman, and her fear of treating that put off that much-needed surgery. Here's her story.
Target shooting is one of Deborah McNitt's favorite pastimes.
It's a hobby. It's fun.
Deborah competes locally. She has a 9-year history of aiming at the bullseye. And she's pretty good at it. But pain in Deborah's left shoulder forced her to take some time off.
For about 2 years, it was just so much pain. I would lift my arm to shoot, and there's not much kick in a .22, but it was enough that it just would send a lightning bolt through my shoulder.
Dr. April Armstrong, an orthopedic surgeon at Penn State Milton S. Hershey Medical Center, looked at Deborah's x-rays and diagnosed her with osteoarthritis in her left shoulder.
What that is a degenerative process in the shoulder. So your shoulders are made up of a ball and a socket, and the cartilage wears out between the ball and the socket. And what that means is the cushion between the ball and the socket that allows for smooth motion of the shoulder is worn away, and you start developing bone on bone, and that's where the pain comes from.
Initially, Dr. Armstrong treated the pain with oral medications and injections, but she knew a shoulder replacement was likely, and that's something Deborah could not accept.
I put it off. I mean, I probably could have had the surgery sooner, but I kept making excuses and putting it off. I had known too many people that had surgery done, back surgery, whatever, and actually ended up worse. And I was so afraid.
So Deborah lived with the pain every second of the day and night. She remembers it well.
I was taking 2 different pain medicines just to get myself through the day, and I was taking morphine at night just to get a little bit of rest. And that wasn't getting rid of the pain, but it was allowing me to sleep.
Enough to get her through each day. At work, Deborah's computer skills were put to the test.
Prior to surgery, I would lift my arm up, and I actually had to struggle to get it up there. And I would kind of lift it there, and I would use my thumb and finger for tab and shift as I typed. And I learned to type with one hand.
At home, it was a struggle too.
I could not lift to do my hair. I couldn't lift to wash my hair in the shower. I couldn't reach up into the cupboard to grab a cup out of the cupboard or put something away. It was, all this reaching stuff was not there.
Finally, Deborah had enough and gave in to her fears.
We ended up doing a total shoulder replacement, and what that means is that you take out the arthritis and you resurface the ball and the socket. So you resurface the socket with a plastic-looking piece. It's made out of polyethylene, and then you replace the ball part with a metal-looking piece. And now you don't have the bone on bone anymore. You have metal riding on a plastic piece. Takes away their pain.
And that's exactly what happened.
The fact that I had no pain I mean, I could have done cartwheels, but you can't do that 2 days after surgery, but I was amazed how little pain I had following surgery.
Deborah wore this brace for 6 weeks and underwent physical therapy for 4 months. I asked Deborah if she has any regrets.
Everybody kept telling me that. You know, oh, you'll be sorry, you'll be sorry, you'll be sorry. I'm not sorry. There's not a bit of me that's sorry. It was life-changing. I don't know what I would have done without the surgery. I don't know that I could have gone on a whole lot longer without being actually insane from the pain.
And remember how much medication Deborah was taking for the pain? She told me after the surgery she did not need to take anything, including aspirin. And as you could see, she has 100% range of motion in her shoulder. Certainly a happy ending. Back to you in the studio, Chuck.
Deborah, that's an amazing turnaround. Joining me now in the studio, Dr. April Armstrong, an orthopedic surgeon at the Hershey Bone and Joint Institute. And doctor, we talked about this earlier before the show, that this type of surgery has been around a long time. How common is this?
It's not as common as hip or knee replacement, but it's becoming more common. And the last report indicated there's about 30,000 done in the last year over the country.
30,000. Now, when someone has this work done and all those parts are put in there and so on, how long can these parts last?
On average, we tell people 10 to 15 years, and we're hoping with our new advances with the replacement that we can improve the longevity.
10 to 15 years. Mm-hmm. All right. Well, there has to be restrictions. You're taking something out, putting something new in. What do you tell a patient like Deborah? What would you tell her?
So I tell them that it's really meant for activities of daily living and light recreational activities. We tell them that on average you shouldn't be lifting on a repetitive basis more than 20 pounds. And things like golf or swimming, it's okay for them to go back to those types of activities, but not contact sports.
And that would obviously change according to your age. Young people want to play some rough stuff, the older people not so much.
Right, and this is usually meant for people usually over the age of 50. As you get younger, there are other options we have to consider.
Very good. Let's check in with Deborah in the ABC 27 call center and talk about some of those questions. Deborah?
Thanks, Chuck. The specialists have been answering the phone since 7 o'clock, and you can see they're all very busy trying to answer your questions. Now, to help us answer some of the questions here is Dr. Robert Gallo, an orthopedic surgeon. Thanks for being with us.
Thanks, Deborah.
Here's the first viewer question. I've had bad neck and shoulder pain for many years. Instead of surgery, I chose to see a chiropractor, which seems to help. Could these adjustments cause permanent damage?
Well, there are several sources of neck and shoulder pain, each with the best treatment. There's very little evidence to support that chiropractic care actually worsens that, but the fact that you haven't improved means that you may not be receiving the optimal treatment for your problem. And I would suggest that you see an orthopedic surgeon to find the optimal treatment.
Okay, here's another question. I've been diagnosed with frozen shoulder. The pain has been excruciating. I've had injections and also a total replacement, but the pain is still severe. What can I do?
Well, stiffness is a common occurrence after a shoulder replacement. The first thing you have to make sure of is that the prosthesis isn't infected. Once it's not infected, the other potential causes would be malalignment of the components or just normal stiffness following the shoulder replacement. So I would suggest that you go back to the orthopedic surgeon who performed the procedure, and they can direct you in the appropriate fashion.
Okay, great. Thanks so much, and we'll talk to you a little bit later in the show. We'll send it back to you in the studio, Chuck.
Thank you, Deborah. And doctor, we were looking at that report earlier, and Deborah, with her gun and everything, was talking about she felt her symptoms were like lightning bolt hitting her shoulder. What are the symptoms of shoulder arthritis?
Really, it's increasing pain. Pain is their main symptom, and they also will notice that they're losing motion in their shoulder, and it's not uncommon for them to have a lot of popping and grinding in the shoulder.
Yeah, you hear people talk about that grinding and popping and so on, so that's a heads up when you feel that.
Yeah.
Well, besides the surgery, what other kind of treatments and options do they have?
Well, we have non-operative options, so a lot of times pain can be controlled with physical therapy, different types of medications, and possibly even injections about the shoulder.
Is that a long discussion process before you go one way or the other?
It is, definitely.
All righty. Well, doctor, thank you very much for joining us here tonight. And when we come back, a simple fall. Now watch this story. A simple fall landed this 8-year-old girl in the hospital, severe elbow fracture. We'll be right back with her story.